I'm Lee Kelso from the HealthCall Live Radio Hour. Thanks for joining us. America is leading the world in the current fight against COVID-19. Vaccinations are happening at a rate of more than 1 million a day. So many people were taken aback when the head of the CDC recently said that she was fearing impending doom as a new wave of COVID-19 spreads the nation. That left many people wondering, what's going on? What does impending doom look like? What might we be facing? Well, to learn more about that, I turned to Dr. Amesh Adalja, who is a senior scholar with the Johns Hopkins Center for Health Security. And I'm glad you joined us today. Thanks for fitting us into your schedule. Can you help me get an idea of what impending doom looks like? Exactly what might be the risks that we're facing after so many people have recovered and are now vaccinated?
This new wave is going to be very different than the prior waves of infection because we've removed a lot of the capacity of this virus to threaten hospital capacity or to cause widespread death or cause serious illness. So I think it's going to be a little bit different. It's going to take some time to get used to that. When you see cases surge in this new era with the vaccine, they don't necessarily always translate into hospitalizations at the level that we saw in the past. So to me, I think we're watching these cases. They need to be controlled. We need to get vaccine into those populations. But I don't think that this wave is going to end the way any of the prior waves have ended, with hospitals worrying about capacity.
I think there are millions of Americans who are thinking to themselves, okay, I've been vaccinated. Where's the reward? When can I stop wearing the mask? When can we get back to normal? And so is there going to be a point when that can occur?
So right now, if you're fully vaccinated, I think you have very little to worry about in terms of COVID-19, either getting it or spreading it. And that's what the data, including data from the CDC, has shown. And I do think you're going to see the general public who are vaccinated rightly start engaging in activities again, because they should and they can, and the data supports it. It's just going to take some time for the CDC guidance to catch up with what people are doing, which I think is a problem, because we don't want CDC guidance to lag what the general public wants or is doing. We want the CDC to be there with the guiding hand, really being proactive and being a step ahead of where we are so that people can look forward to certain things. But unfortunately, they've been cautious here. And I think that's somewhat underselling the vaccine. And as you said, it does give people this pause. Why should I get the vaccine if it doesn't change anything? But I tell you that the vaccine does change everything. So do get the vaccine. This will be the path to normalcy. This will be the way that we get rid of mask wearing, because so many people will have been vaccinated that COVID-19 will no longer be a public health threat. And it's increasingly becoming that way as we get our high-risk populations vaccinated, and it will become more so as we go into those other lower priority groups that haven't had access to the vaccine.
So the president saying, urging governors keep those mask mandates in place, it does feel as though they're kind of behind where the rest of us are. So what are the criteria that you would feel comfortable urging governors and others to take a look at and say it's safe to lift requirements or restrictions?
When it comes to masks, I think that we're going to see masks be part of public health guidance for probably long into the spring and likely into the summer, until we get at least some level of control of this virus that's better than it is now. So right now, maybe there's 65,000 or so cases occurring daily. I think once we get down to below 10,000 cases per day, if that's possible, I think that's when you're going to see some of these other governors who have mask mandates in place start to lift those as this becomes less and less of an issue. And I also think what's happening is it's becoming difficult because we've so much been focused on cases that when you now remove the ability of this virus to cause serious disease, hospitalization, and death, it's going to require a shift in the risk perception of the virus, and that's going to take some time to do. The goal here is to get enough control of the virus that you don't have COVID-19 disrupting your business, disrupting your activities, even after it's lost its ability to cause serious disease and threaten hospital capacity. And I think it might be a different timeline for different states, but I think it is something that we will see in the future as more people get vaccinated, and hopefully with eligibility increasing in states all around the country, we will start to see decreases in spread, as well as the decrease in hospitalizations that we've already seen.
So you just said we need to get to a shift in the perception of risk. By whom? Who? I think many people are already there. Is it health officials? Is it county health commissioners, the CDC, and others that need to kind of catch up to where the rest of us might already be?
I do think that there are some health authorities that will have to shift their perspective because they've been so much focused on cases, because in the past, case spikes incontrovertibly led to hospitalizations and deaths. And now that's not happening. So they have to shift what their mitigation strategies are built on and look more at hospital capacity. And I think that's going to take some time because they've been so attuned to just looking at the sheer number of cases. But now cases mean something different. When a case cannot kill somebody, when a case cannot land someone in the hospital at the same rate it could in the past, this is a different type of virus. And that was the whole goal of this. That's the whole goal of why we had vaccines. We wanted vaccines to stop three things: serious disease, hospitalization, and death. And they're doing that. And the more we vaccinate, the more they are going to do it. But we're not going to get to COVID zero. This is a efficiently transmitting respiratory illness, which is going to become endemic. It's going to become one of our respiratory viruses like influenza and RSV and adenovirus. So we've got to come to a point where we understand that there's going to be cases in the community, and we're much better able to handle them because our high-risk populations have been vaccinated.
Are you anticipating booster shots? Are we going to be back into a mask environment? This virus, as you said, is not going away. What might we be looking forward to as it mutates and as we move forward?
It's hard to know exactly what will happen. I think it's also too early to know if we're going to need booster shots because we haven't done the natural history studies where we follow people out to see what happens to their immunity, what happens to their susceptibility to reinfection. And for me, the variants and the mutations, the threshold for needing an updated vaccine really is when vaccinated people are getting infected and landing in the hospital. And to my knowledge, that's not really happening right now. That even in the face of the more troublesome variants like the South African variant or the Brazilian variant, the vaccines are still able to stop serious disease, hospitalization, and death, even though you might get infected. So I think that's all we ever wanted a vaccine to do. I think it's important to study updated vaccines and booster regimens, but I don't think we're ready to pull the trigger on needing those. I do not think that we're going to see, once we hit herd immunity in this country, mask mandates come back in place for COVID-19. I think you may find people that will want to wear masks because they've this has become part of their wardrobe, basically, and they've seen the benefit of it because not only do masks help with COVID-19, they help with other respiratory viruses like influenza as well. And you might see certain businesses, especially where social distancing isn't possible, they may want masks for some period of time, even after mask mandates. And indeed, we've seen that in states like Texas and states like Florida, where there are no longer or haven't been mask mandates, that there are some private venues that still require masks as an entry requirement. But I think it's unclear what's going to happen with these mutations and if this settles down. But remember that this is the 7th human coronavirus we've discovered, and 4 of those other coronaviruses cause 25% of our common colds. And this may become something like that once it is tamed through widespread vaccination.
All right, we have to leave it there. My thanks to you again, Dr. Amesh Adalja, Senior Scholar at the Johns Hopkins School of Health Security. Thanks very much.
Thank you.